I wanted to heavily focus and make the project more about communities than, as an agency just going in and getting data. That was not the intent at all. I do feel like I was quite successful in getting sufficient community participation. So right from deciding where in neighborhoods we wanted to put up the monitors, that was all community input. I took a lot of time meeting individual communities, individual citizen boards and things like that. And we also had 4 or 5 more open town hall style building meetings where we just invited people to come in and then listen to the project and then give us input on where they wanted to see those monitors go up. So that was quite rewarding. We kind of emphasized when I went out uh, to do meetings on location selection that we wanted it to be more focused on where they live and not specifically focused around the facilities in their neighborhoods. So I think that kind of really changed the way people thought about this project and kind of got them more interested in knowing what was around their house. So the broad objective of the project was to kind of get a background of what air quality is of some criteria pollutants, including PM2.5, which is a big concern in Minneapolis and St. Paul. So the project has air quality sensors in all the zip codes in both the cities. Some larger zip codes also have multiple sensors in them. And we are measuring a whole bunch of gases as well as PM 2.5 and PM 10. And as when we go out and talk to citizens about their concerns, or if you're going to the community to discuss um, permit action or anything about a facility, then these questions always come up. How much is it contributing to our health and things like that. But we don't really have an answer because we don't know what the neighborhood level or the community level air exposure is. So this sensor project is an attempt to get that and to see how neighborhoods differ from one another, and if that and how much of that actually contributes to individuals lifestyle and what changes they can make on a daily basis. At a zip code level in Minneapolis and St. Paul, there are certain zip codes that tend to have higher health impacts than other zip codes. Um, and that's also one of our reasons for seeing if air pollution also follows similar patterns or not. And then, if we do see that patterns, then we'd probably dig into it. But, I would speculate that there are definitely social and mental health effects if you're living in a highly polluted area, especially if you have these kind of health effects. It impacts how much time you can spend outdoors, how much time you can spend playing and doing those social activities. And in the summers, with windows and things like that open, it also kind of affects your quality of life inside your own home. So I guess from when I was in school, ecology and environment kind of always interested me. So I have a bachelor's, master's, and a doctorate degree in environmental health and environmental sciences. Um, and my very initial career back in India was in public service as well. I worked at an NGO in very close collaboration with state government. And, in having that independence to do projects that directly affect communities was something really close to my heart. And it gives me immense joy to just interact with communities and kind of find out what their issues are. Not that I can solve everything, but then, to kind of have the research background to design projects that will at least help answer some of those questions is something I enjoy.